the cancer statistics are expected to double worldwide. We're diagnosing more people every year. That's what you and I get to talk about today, is like the metabolic flexibility, hypoxia, and all these conditions that we do have control over long before it's an out of control situation.
Where does hyperbaric oxygen therapy fall into mitochondria talk and cancer?
What happens? It just gives me chills. You turn on and off so many mechanisms, so many signaling pathways that you are literally recalibrating, resetting the entire system in a matter of 60 to 90 minutes.
We don't need that many sessions, really. We just have to do it right and squeeze everything we can from that session.
Welcome to Hyperbaric Living Podcast. I'm your host, Dr. Nasha. Today I have with me Dr. Nasha Winters. Dr. Nasha Winters has experienced cancer at a very young age. She was diagnosed with ovarian stage 4 cancer at the age of 19 and was given only 3 to 6 months to live. 31 years later, Dr. Nasha is a worldwide authority in integrative cancer treatment. She consults with physicians worldwide, and right now she's on a mission to build a metabolic institute of health that will change the standards of care to cancer treatment. Today, we'll be talking about metabolic approach to cancer and the role hyperbaric oxygen therapy has in cancer treatment and cancer prevention. Welcome to the show, Dr. Nasha.
So good to be here. This is just a joy to be trans-global with you today.
Yeah, it is trans-global. We are here in Mexico. I'm in Madrid. 2 Spanish-speaking countries, 12 hours on a plane.
Here we are. Talk about issues of hypoxia travel between those two places. But no, this is a joy that we can transport together in this technology. So thank you for having me. First of all, a little context is, just like anybody else who gets into the field that you and I are in, we usually have a personal story that brought us here. So I am now over 30 years out from a stage 4 terminal cancer diagnosis, which put me on a path of curiosity to keep finding all the different ways that can best support somebody with that type of diagnosis. So fast forward to where we are today, and that growing need, the number of patients demanding the approach in which I teach, which is about the metabolic approach to cancer, the growing number of cancer cases, unfortunately, worldwide, has led to sort of my path and purpose, which you and I will go into later in our talk today. But where it all began for me back in 1991, way before Dr. Google, was in my own diagnosis, stumbling across the work of somebody known as Dr. Otto Warburg. And that work resonated with me much more than what was current at that time of the 2-hit theory of cancer, which is sort of like you have enough genetic mutations and then one big genetic mutation happens and then you've got a cancer process. And though I knew I had a strong family history of cancer, I also knew I had a lot of lifestyle, dietary, trauma issues that definitely led to my cancer diagnosis. And so when I read about Dr. Warburg's thoughts that cancer really starts at the level of the mitochondria, which is the power plants of our cells, which is where metabolic health takes place, either is made or broken down based on what's happening in those mitochondria, that resonated with me far more than what I was learning in my pre-med science classes. And it was what led me into starting to explore how to turn myself back into that hybrid engine I was meant to be, how to both be able to burn sugar as needed, fats as needed, and to be able to go comfortably in a fasted state as needed. And that sounds kind of simplistic, but for your listeners, it's come down to I think about 3 years ago, we had a study come out that showed that Americans, less than 12% of them are metabolically healthy or metabolically flexible. And so that really is what's kind of led to what you and I are conversing about today is the vast majority of us are not hybrids. We are not able to burn the right fuels at the right time or even avoid the fuels altogether comfortably. And so that's where we begin, is initiating what's known as that metabolic flexibility and starting to assess people's metabolic flexibility.
And that's what led you, and because it's an amazing journey. When you read about it, it's just, wow, what a purpose to come to this planet. I know maybe at the beginning it didn't feel like
Oh
that.
no. No. It's, in the beginning, I think you're kind of like, why me? And now it's like, why me? More of, wow, what a blessing and a gift that I was offered this opportunity to shine some light on this very topic, this very issue that plagues what will be potentially 50% of the population sometime during their lifetime on this planet today.
I think by the 2030, right?
Yeah.
Every third or in some countries, depends whether it's developing countries or not, every third person or every second person is going to develop cancer at one point in their lifetimes.
Yeah, it's daunting to see those statistics and to feel, we're kind of over here celebrating these small victories of increasing someone life expectancy by two to 2.5 months. And we're like, yay, that's great. And yet I guarantee most people would like a lot more than 2.5 months, and they'd like a lot more of quality of life during those 2.5 months. And so why aren't we even helping people understand how we prevent even coming to that point to begin with? And World Health Organization, to your point, in 2030, the cancer statistics are expected to double worldwide. So we are not winning any wars on cancer here, despite what the evidence is trying to, paint a picture around of, oh, we're finally making headway on overall survival and diagnoses, but we're not. We're diagnosing more people every year. The only difference is that we might be looking on paper like we're living longer with cancer, but we're just being diagnosed earlier with it. And so we're really not helping people change the game long before the cancer process takes root. And so that's what you and I get to talk about today is like the metabolic flexibility, hypoxia, and all these conditions that we do have control over long before it's an out of control situation.
And as you mentioned, that's for my listeners, this metabolic flexibility happens at the level of mitochondria. Could you explain to us what happens at the level of mitochondria when a person not necessarily gets diagnosed with cancer, when they get cancer, or prior to that? What is happening in mitochondria?
Sure. I'm going to be very simplistic about this because the biochemistry can be pretty heady, and I'm not a biochemist. I'm a clinician. I'm also historically a patient. So I like to look at things more through analogies and the way I understand and interpret them. In the cancer cell, what happens is it accumulates sort of this gunk. Imagine just like a residue building up in your, like the chain ring on your bicycle, right? You can still push those pedals and get down the road pretty well, but it gets more and more gummed up and more difficult to push those pedals. That is literally what's happening in what's known as the Krebs cycle within the mitochondria. And the mitochondria are like little packets of this, what they're called organelles. They're like little organs of the cell that live within there. And within that highly specialized little organ are all of these processes around creation of ATP, our energy. We used to think that's all that mitochondria do, but they're also very much in charge of taking out the garbage. So when we get too much junk, in the system, our healthy mitochondria are able to take out the garbage, known as apoptosis, programmed cell death. But as they get more gummed up, more burdened, they start to fail in their efficiency and their effectiveness in taking out that garbage. And in doing so, that accumulation starts to change the way that cell behaves. So it does what's called a metabolic shift from healthy respiration, healthy breathing mitochondria into unhealthy loss of breath, suffocating mitochondria, which is what kicks off this whole metabolic shift into a very different behavior cell, which lends itself to a cancering process. So there are a few words in there that will be kind of probably unpacking here, but what happens is basically from the healthy cell to the cancer cell, we lose breath. We lose respiration, we get gummed up, and we're unable to perform our day-to-day activities of dealing with the thousands of ongoing assaults each of us get every single day, every single moment, every single one of our cells. That's what accumulates. And so the importance of keeping that mitochondria sort of fluid and moving and non-gummed up and keep it well respired, good breath into it is really key to maintain that balance, to keep it from moving into that metabolic shift.
So as a naturopathic doctor, asking another naturopathic doctor, I'm going to ask you, prevention, where does this junk come from?
Oh gosh.
How do we accumulate it?
This is such a good question. And what's so funny is, again, we think what we thought about for many years in the cancer world is we consider that this was just a genetic problem, right? And we've learned that it's not that we throw the genetics out with the bathwater. We know that the genetics play a role, but only after that metabolic shift. So think about your mitochondria as the protector of your genome, right? So it's like your first line of defense. And it's also that first line of defense, the mitochondria, that I've created this kind of concept around what I call the terrain 10, or the terrain 10 drops in the bucket that impact the way that mitochondria is breathing and functioning. And it includes things like your epigenetics. So what was passed down from previous generations that you have the ability to change the expression of in your lifetime. Number two, what is the fuel source you're giving your body? Are you feeding it real food, quality food, nutrient dense food, seasonal, organic, local food, or are you feeding it packaged, processed, highly chemicalized, highly contaminated foods that our bodies literally have not genetically adapted to? Like, they don't know what this is. It's relatively new in our food system over the past 150 years. And so that's a fuel source. Plus, has your body forgotten that it is a hybrid engine, that it can burn fat on as needed, or carbohydrates as needed, or even fast comfortably as needed? Most of us are overfed and undernourished. And we feel panic if we go more than a few hours without food, and we get the hangries or we get shaky. That's a metabolic drop in the bucket problem. Then we look at things like the environment. My gosh, as we now know, one of our colleagues who has since passed, kind of the father of naturopathic environmental medicine, Dr. Walter Crinion, says that it's no longer a matter of if you have toxicity, it's how much, how bad is it, and how does it interplay with your epigenetic blueprint. So we know that drop in the bucket. The microbiome, gosh, we've been ignoring this for so long, and naturopaths and Chinese medicine practitioners and Ayurvedic doctors for millennia have talked about the importance of the gut and the gut microbiome, and yet it's been really ignored until we were able to basically do some scientific studies around it and create some pharmaceuticals around it to finally bring the conversation into light. And then things like our immune system. If you're not talking about the immune system in the last 2 years, you're definitely living in a hole somewhere, because we know that we've got a lot of problems when so many of us are facing a virus that we can't deal with. That's a sign of how metabolically and terrain centrically broken we are when we can't deal with these things that do come around from time to time. And then inflammation, poor oxygen, so hypoxia, poor circulation, blood pressure issues are definitely a part of that drop in the bucket. And then hormone regulation, balance, stress, and circadian rhythm. And the final big old drop in the bucket is mental, emotional health and well-being. So all of those things, interestingly enough, contribute directly to the health and wealth and well-being of your mitochondrial function. And any one of those drops being out of range is an obstacle to that mitochondria functioning as perfectly as it should.
So we got to the stage when mitochondria is malfunctioning and the cell has turned into cancerous cell. Where do we start? Do we look back at all the things that are influencing the health of mitochondria and starting to change them right there, all the factors?
I love that question, because that's a very simple way that most people can kind of do their own audit. We actually have a questionnaire in the front of the Metabolic Approach to Cancer book. It's a questionnaire that asks 10 questions about each of those 10 drops. And then you can take that quiz yourself and realize, what are your priorities? Maybe what were the things that did contribute to landing in this moment, or helping prevent you from landing in that metabolic shift moment in the not so distant future. So looking at that, what I encourage people to do is maybe look at the top 1, 2, or 3 of those priorities, of those drops in the bucket we just described, and start there. So that's one place you could start, and like starting to actually do an audit on what you're eating, diet diaries, maybe get some basic blood tests and look at your insulin levels. Maybe take a look at your macronutrients. There's a bunch of free apps out there to look at your macronutrients. And one of the most significant and free changes you can start to make to the entire bucket, and even though it's metabolically based, is start to incorporate things like intermittent fasting. And so little pauses of eating, maybe you eat only within an 8 to a 12-hour eating window every day, versus kind of grazing 24/7 and having a snack right before you hop in bed. And so your goal is to be able to easily, comfortably go 13 hours from dinner to breakfast with nothing but water. And if you can't do that, you've got some work to do to start. right? And then over time, work it up to maybe being able to do 16 hours twice a week without food. And then maybe once a month, 24 hours. And if you are someone dealing with cancer, using a longer strategy, such as 3 to 5 days per Dr. Balter-Longo and a lot of the longevity researchers and cancer researchers, can be used around your time of chemo, but also he recommends using it at the end of treatment for 6 months, a 3 to 5 day water fast every day for 6 months to clean up from the treatments. And then folks out there in the cancer research world, mitochondrial research world, they recommend even anywhere from a 5 to 10 day water fast once to twice a year, just as your cancer prevention or cancer recurrence prevention. So those are some strategies that hits, though it most likely hits the bucket of your metabolic. 3 days of a water fast also completely upregulates your immune system. It also changes a lot of epigenetic expression. It also massively lowers inflammation. It also releases all of these amazing endorphins and puts you into kind of a meditative, calm state. So it's impacting the stress response as well as the mental emotional response. It resets a lot of our hormonal signals. So as you can see, fasting pulls a lot of the levers of almost every single one of those drops in the bucket, including changing your microbiome over a matter of a couple of days going without food.
I love this conversation because I love it because I do believe that diet is the single most important thing. This is where every treatment should start. And I just want to give people a little bit of encouragement. We tend to switch from being metabolically inflexible to being metabolically flexible quite fast.
Yes.
It's not like you need to do it for a year or even 6 months. That happens really fast if you follow the rules.
Yes, exactly. I love, and it's so, talk about one thing I love about it is it's so empowering. It shows people what they are capable of. And it puts us back in charge because we were never meant to graze 24/7. So knowing that there's support out there and support groups out there, and people like Dr. Nasha and myself, we are really comfortable guiding people through these types of discussions and helping them start with the baby steps and incrementally work up to something. Every single step is impactful. You don't have to do a 5-day to get all the benefit. A 13-hour is pretty remarkable.
Yeah, that's really powerful. Where does hyperbaric oxygen therapy fall into whole this mitochondria talk and cancer?
Well, it's interesting because oftentimes when people are metabolically inflexible or metabolically broken, it tends to go hand in hand with something called hypoxia. So lower levels of oxygen into the cells, into the circulation, into the tissues. And so interestingly enough, they go so hand in hand of our ability to perfuse our tissues with our metabolic health that when we are hypoxic, when our oxygen levels are low, we downshift our mitochondria. So we become less efficient when we're having, when we're deconditioned, when we have sleep apnea, when we're obese, or when we have a physical injury that's not allowing us to move any longer, or we have any damage to our lungs or our cardiovascular system. Those things can create some hypoxia. So if you are someone who snores or wakes up feeling really groggy, if you don't know if you snore, you're likely poorly perfusing and having hypoxia during the middle of the night. So evaluating that, because even Dr. Otto Warburg said that if you diminish your oxygen levels by just a few percentage points, you increase your potential to cancer, like massively, like 48, it's like some crazy statistic of 36% reduction of your hypoxia increases 48% of your ability to turn that metabolic shift into cancer. So it's really important to look at those pieces. So when we're evaluating the metabolic health, we also want to evaluate like people's blood pressure. Is it too high or too low? Their pulse rate, is it too high or too low? Feel their pedal pulses. So the pulses down on their feet. Can you feel them? If you're not getting good circulation, or if the feet are cold, if there's pooling of blood and whatnot, in that area you're dealing with hypoxia. If you push on your fingernails and you don't see good return of blood, you're usually hypoxic. If you're having any issues with breathing, if you're a shallow breather, if you don't breathe deep into your below your diaphragm and into your belly, you're likely dealing with some hypoxia. So you want to kind of explore that as well, how you breathe, how you respond to stress. Do you clench up, the vagal nerve, the lung area? Do you hold your breath when you're under stress? Most of us are always needing to take a deep breath. So how these two come together is, we know when you're hypoxic, you create metabolic shift in the wrong direction. We know when you're metabolically broken, you increase hypoxia. Okay, so the two, they're like literally BFFs, they're running down the path together. So when we can bring somebody into a hyperbaric chamber in a fasted state, 13, 16, 24 hours, even 13 is great, you guys. What happens? It just gives me chills. You turn on and off so many mechanisms, so many signaling pathways that you are literally recalibrating, resetting the entire system in a matter of 60 to 90 minutes. Incredible to me, the impact of this. And people like Dr. Adam D'Agostino and Dr. Angela Poff and a lot of the researchers out there in the field of metabolic medicine and brain tumor pathology, there is like literally not a better cancer treatment for brain tumors than a combination of being in a state of therapeutic ketosis or in a deeply fasted state, which will kick up ketones, with a combination of hyperbaric oxygen. It is incredible what it's doing to literally all 10 and now the other 4 emerging hallmarks of cancer. And so it is one of the most potent tools. So thinking about that, if you're someone who's new to the journey, trying to create metabolic flexibility, hyperbaric oxygen can help push you up over that hurdle. And if you're someone who's using hyperbaric oxygen, say for radiation burn treatment or a recovery of a wound or a recovery of a TBI, what is ironic is most of those conditions also have metabolic drivers. And so getting in that hyperbaric oxygen chamber may also inspire, I use that word very specifically, you to make some of the other changes necessary. So that might prompt you to make some changes in your diet, make some changes in your eating and lifestyle habits. They come together like PB&J, right? It's just a really beautiful merging of those two that impact almost every single one of our signaling pathways and can mutually support one another exponentially.
Does pressure matter? Does it matter if you go to 1.3 or 2 or 2.4? What's your experience?
Such a great question. So my experience has been that any amount is helpful. Pressure or no pressure. When you're wanting to use it as a pro-oxidative cancer killing therapy, pressure does weigh in at that time. Okay. So if you're trying to use it to help treat brain cancer, you need to be in a pressurized, higher oxygen environment to get that benefit. But if you're wanting it for maintenance of the condition, of overall support, of enhancing other therapeutic interventions, including diet, the deep no pressure is still as beneficial, and a lower amount is just as beneficial. So I want folks to know that it's like you don't have to do it perfectly to get benefit. Just like we talked about starting somewhere with fasting, 13 hours is a great start. But if you are looking at leaning onto it as a true hardcore toxic therapy to your cancer, please go down to that more aggressive approach. But if you're looking at enhancement of all of your other therapies, supporting you and pushing you over the hurdle of those therapies, boy, how to use whatever you can get your hands on.
Do you recommend supplemental oxygen to go with it? If
you're able to, that definitely helps, especially if you know that you have hypoxia because you're seeing low levels of pulse oximetry during the day. So maybe you're showing up below 97% at rest. I would definitely consider the supplemental oxygen in that population. And I would definitely consider that supplemental in people who have sleep apnea, who have to use an apnea machine at night for sleep. I would definitely want that because they've already kind of built up a little bit of a resistance to just letting it get in naturally. So the extra support to help you perfuse as well as diffuse, as well as oxygenate, they're different because you can bring in a lot of oxygen by itself. And if the cells can't carry it and diffuse it across cell membranes into the areas, it's probably helping a little bit, kind of scouring the system, scouring the blood, but you need it to cross some of those cell walls and to get into its rightful places to do more. And that often requires extra, oxygen within the chamber as well as pressure. The pressure is what helps drive it across those gradients. And so, that's why you'll see people using things like ozone therapy and hyperbaric therapy in treatments of infections, because that's helping kind of scrub up the serum, scrub up what's in the typical blood flow. But if you want to go deeper within changing, say, the mitochondrial Krebs cycle pathway, a little bit of pressure is going to be much more helpful. A lot of pressure, depending on your therapeutic sort of goals, is going to be, the most helpful. And so that's the place, is there sort of gradients of how aggressive you need to be depending on the condition and the goal of the therapy. But anywhere along the way, you're going to bring benefit to the whole.
And what about the frequency of the treatments?
Yeah, this is a great one. This also gets into that N of one. If I have a patient who's also taking on other oxidative therapies, perhaps they're in radiation or chemotherapy for an aggressive cancer process, there's already a lot of reactive oxygen species. There's already a lot of oxidative stress and inflammation, and the body can already be in a little bit of an overwhelmed state. So it's ironic because that seems to be the time when you want to use the most of the hyperbaric, but I tend to stagger it a bit more, maybe 1 or 2 times a week, so I don't overwhelm the body with tumor lysis or cytokine release syndrome. If they're not doing concurrent extreme cytotoxic therapies 2 to 3 times a week, even upwards of 5 times a week, depending on the situation, is completely appropriate. If I have someone who's through treatment and now they're just wanting to kind of clean up for maintenance, we might do, if they've never done hyperbaric before, we might do a series over a few weeks, short weeks together, so that are more close to each other, maybe 3 or 4 times a week. And then we start to go maybe twice a week for a couple of weeks, and then once a week for a few weeks, and then once or twice a month for a few months, as sort of cleaning up the rest of the system. So I know it's kind of an obscure answer, but it's so dependent on the individual and what their labs are telling me, what the goal of therapy is telling me, what their oxidative stress load is telling me, whether or not they've got some big treatments on the horizon. Like if they're trying to recover from a surgery, we may be more aggressive than someone who's just like trying to clean up from previous treatment. So I love this therapy because I think as naturopathic doctors, we really appreciate this N of one concept of that we treat the individual, we don't have protocols. And I think that hyperbaric is one of those beautiful therapies that it allows us to practice the art of medicine and the alchemy of medicine and partner it perfectly with the patient's needs at any given time. And so it's really nuanced and really powerful. You can't really screw it up too bad unless you bring it in certain extreme contraindicated environments, or you maybe overdo it. I have seen people overdo it. Maybe they were like going aggressively 5 or 6 times a week. They had a chamber at home and they were going 90 minutes and they were bringing it, and then their body just couldn't keep up because the dump that also happens into the lymphatics or the die-off, if you're dealing with a co-infection, overwhelms the system. So we want to make sure the organs of elimination are working. We want to make sure we're nourishing the body appropriately, hydrating the body appropriately, that the electrolytes are in balance. There's a lot of factors. And I'm sure, Dr. Nasha, you talk about this a lot with your patient population or even on your podcast here, but there is no one way to do this.
I love this because it's got to be, medicine should be individualized, should be personalized. Absolutely. Yes, there are protocols, but they should be taken as a guide more than anything else, because every person is different, right? And we're treating a person, not treating a disease. You've mentioned that hyperbarics goes really well with ketogenic diet or fasting. They're best friends. Are there any other friends that they're friends with? Any other therapies? Like, what do you really like to combine it with?
Sure. I mean, my gosh, first of all, I really like to actually have people take, even if they're not in a ketogenic diet, we like them to come in fasted at least 13 hours. And we will often, for those who are brand new to this and who are not yet in a therapeutic ketogenic diet or metabolically flexible yet, we'll use exogenous ketones 20 to 30 minutes before they get into the chamber. That's actually a really powerful tool because it can potentiate the effect of the oxygen. The other thing I like to do is I like to have people doing other therapies that are also helping with perfusion and circulation before and after the chamber. So, things like exercise, obviously, is really powerful. Exercise, without oxygen, those are kind of really cool therapies that can kick up some hormetic changes in the tissues to make the body more able to scoop up, absorb the oxygen when they get in there. Even things like taking, depending on the situation, I'm careful with arginine with folks that are actively cancering, but something like a nitric oxide inducer, taking like a shot of one of, I think Apex Energetics has the nitric balance, and we'll have people take a swig of that before getting in, or niacin before getting into the chamber. Anything that's going to help with perfusion, anything that's going to help with capillary dilation, anything that's going to help open up, the circulatory pathways. A lot of herbs do this, so a lot of the ginkgos do this, things along those lines. So that, or even spices, having a nice spicy meal or a cup of ginger tea, something can kind of cause diaphoresis as well. So helping you sweat open up the tissues even more. Those are some strategies that we've used. We've even had people like hop into the sauna first and then into the chamber, or have high dose IV vitamin C and then get into the chamber. That's another really powerful combination. I'm just trying to think of a few. I mean, there's so many. It's like, I feel like it's like an unlimited like shopping cart that you can just kind of pick and choose whatever you want. But it is really powerful if you can get your patients to do things that are helping their perfusion and oxygenation between sessions in the chamber.
All these strategies will potentiate the effect of hyperbaric oxygen therapy. Do you have other tips? Maybe some simple tips, before a person gets inside the chamber or after they get out of the chamber to prolong the effect or potentiate it?
Sure. So I've had, so again, I've played with this with a lot of patients for a variety of reasons. I think the exogenous ketones are very, very helpful. Even if someone's in ketosis, it gives an extra bump and it puts a little bit of extra pressure internally on the system that I think that's a powerful tool to use. So that would be one I would recommend. If I have someone who I've worked with for a while and they're familiar with what it feels like to have niacin in their body, which can feel like a pretty interesting prickly sensation if you're not used to it, and can be frightening to people, but that prickliness is just a capillary vasodilation process. So as awkward as it is, it's a really powerful tool to pop, depending on how much niacin they've taken historically, usually a couple 100 milligrams will do it to get in there and really open up the dilation process. The other thing that I find is really helpful, a lot of people have played with the H2 tabs. So a lot of the hydrogenated water. So I think Quicksilver Scientific makes them. There's a few companies out there, and you put these into a little glass container, just drop it. You don't want it in metal or plastic or anything like that, but you drop one of those in and it really increases the hydrogen in your system as well, which seems to be another powerful tool. And I have patients take one tab before they get into the chamber. And typically they're doing a 90-minute, 60 to 90-minute dive, and then 4 hours after the chamber, another. So those have been strategies we've seen that kind of carry the impact on and on and on. And if you are someone who's metabolically healthy, who is accustomed to fasting more often, I don't want people to eat on the day of hyperbaric. I prefer they stay fasted at least through the rest of the day and breaking the fast the next morning. So it's a nice time to sort of center it in the midst of a good, anywhere from 16 to 5 day, 72-hour water fast is a great time to do that in there, because it really seems to potentiate the effect. And then if folks do have issues with like Lyme or something where there could be die-off, which can happen a lot with oxygen, I want them taking a binder at bedtime. And that's actually probably a good strategy for everybody in a hyperox, because what you're doing is when you're pushing things across a gradient, you're pushing stuff out as well, right? And so you have that now liberated and moving around your lymphatics and in your circulation and potentially in your liver and your GI tract and your kidneys. And so taking a binder that contains things like humic acid, fumic acid, or fulvic acid, charcoal, bentonite, those things that can bind it, as long as you're taking it away from supplements or medications, can be another strategy that helps help take out the garbage. So when we talked earlier about the health of the mitochondria, that's what we're ultimately doing with the hyperbaric oxygens. We're kind of giving it a push. It's like we're bringing in like a cleanup team with the hyperbaric. And so some of these other tools are helping the organs of elimination work a little better and helping the body take out whatever garbage is liberated from that combination.
Thank you. I have a name for this. We should call this precision hyperbarics. So you were talking about it, and I'm thinking, then we don't need that many sessions, really. We just have to do it right and get them up. We need to squeeze everything we can from that session.
Love it. And teach them how to keep kicking the can down the road when they're out of that chamber as well. That's the key. It's so beautiful. It's giving you the running start. And so I like that the way you're thinking about that, because that would seem to me a strategy that could lower the need for the amount you're doing in a short given period of time, or for the duration you're doing it in.
I absolutely agree. It's like going to the gym and not knowing what you do there, and just maybe do a little bit of this and a little bit of that, but at the end you don't get much benefit. Or going for 40 minutes or 30 minutes, but you know what you're doing every single second. And you grow, and then you don't have to go every day, really.
Exactly. You are absolutely going in with intention and fortification to help utilize that tool to its absolute highest benefit. Yeah, absolutely. Very cool.
Can people who don't have cancer, or they were not diagnosed with cancer, as far as they know, they don't have cancer, can they use same strategies
Absolutely. Absolutely. In fact, I was just so here's the funny thing. I've been on this cancer journey for myself for over 30 years. I've literally helped at this point over 10,000 patients on this journey. Up until April of 2022, I had never taken a dive, never. And there's a million different reasons for that. It just worked out to why that was. And I had an opportunity, and I'm not currently, knock on wood, or to my awareness cancering, but I was dealing with, I was in an environment, because we haven't traveled for 2 years for work. It was one of my first big events out and about. So the energy of being around so many people, although it was divine, my body was like, what is this? There's a lot of people in my field. The travel to get to this conference, being in a conference site that had mold and new like carpets and stuff, I was feeling really and the terrible lighting and the terrible water quality. I mean, talk about every assault on my mitochondria got hit all at once. And I was feeling really crummy, and I had to be on for another few days. And so I was already in a fasted state. I fast when I travel. So I was already 2 days into a fasted state. I had my H2 tabs, and I popped one of those, and I went and I got into a chamber for 90 minutes. First of all, I will tell you, I felt like I was having kind of an out of body, like psychedelic experience. I went into such a floaty, powerful place, and I could literally envision every one of my cells that were like sad and kind of crumpled just go whoop. Like I just felt like a big sunflower open up in every one of my cells. It was just incredible. And I could feel my body be able to tolerate what it was being exposed to in a very different way. And so I maintained. About 4 hours later, I took another H2 tab, and I just hydrated. I kicked up, I went and got some electrolytes. And I was able to not go. Normally in a situation like that, I would just continue to crash until I got home and did my stuff at home. But I was able to right the curve of this in the midst of a deep dive into going downhill really fast and maintain it. And I ate like that night. I didn't eat that night. I didn't eat till the next day. I kept it super clean, super low carb. I didn't bring on alcohol. I didn't come in and like add more burden to the system. I flew through that experience, and I'm thinking, how have I not just been doing this for my own tune-ups and my own maintenance? So I would definitely recommend it for folks who have to travel a lot or know that they're very vulnerable, sensitive to environmental toxins or even energetic toxin environments. It was quite profound for me to have that N of one experience, because I'm always accustomed to having it used for like repair from surgery or wound care, or overcoming radiation, fibrosis. And I mean, I'm usually using it very medically. And it was, and I know tons of people, like all of you, I'm probably saying, duh, everyone's probably going, duh, Nasha, but it was so much fun for me to use it more. I don't want to use the word recreationally, because I definitely needed it as a medical piece here, but I could imagine it being used more as a tool of prevention and support a lot more often than I was currently considering it.
For wellness, really. Yeah, using it for wellness is just amazing, because all of a sudden you feel, oh, I can really take my wellness or well-being to the next level.
Yeah. Resilience. I think the key for me is I felt the resilience come on. I also think it helped my flexibility, my metabolic flexibility, the whole bit. I think that was just laying in there having those ahas, because that's your like, what was your aha? It was like, I know this does this intellectually, but I felt it physiologically. And that was super cool.
Yay. It's April. That's like 2 months.
A couple months back. Yeah. Hilarious. I was this many days old when I learned that it was a very powerful tool for me.
It's never too late, really.
Yeah. And I think that's one of the things. In fact, one of our, because we were there with a group of the folks that were running our institution, the Metabolic Training Institute of Health. We were all there at this conference together. And a few of my colleagues, as part of that project, also got into the chamber for their first time. And one of them ended up buying one to take it home. And one of them, her husband, her partner, was a firefighter and has had lots of health issues, lots and lots, and very much a canary in the coal mine for all exposures. And I'm certain that this is going to help him overcome some of the massive toxicity that population is just, he had to leave the fire department on disability because of the impact on his health. And so I'm certain this is going to help him start to take out that garbage and get his mitochondrial pathways working much more effectively and efficiently. And he already does the diet perfectly, but it's like there's something missing. He can't quite come up over the hurdle. And I suspect that this is going to be the trick there.
Thank you for this conversation.
Prevention. I mean, we say this all the time, that the only cure for cancer is prevention. And so things like this, like, don't be that 1 in 2 men or 1 in 2.4 women expected to have cancer in your lifetime. Start evaluating, auditing your terrain now. Start to work on your metabolic flexibility. Start to work on your perfusion, processes, because those are your true longevity tools. Those are your true, fountain of youths. And so keeping with that is a very powerful strategy.
You've mentioned some really good resources. You mentioned
Mhm.
your book, you mentioned the Institute of Metabolic Health, your website, where people can find you. Because
Sure.
from what I understand, you're not consulting patients at the moment, are you?
Not taking new patients, but I train physicians from all over the world. So we have an incredible network that we're expanding. We're also training patient advocates in the metabolic approach to cancer, as well as physicians. At this point, as of, where are we? June 2022, we have over 88 physicians who've gone through our training. We have almost 200 patient advocates who are going through the training. We start our 6th cohort in the fall for physicians, as well as our 3rd cohort for patient advocates. So our plan is the focus is to grow this network so that this conversation that we're having becomes common versus obscure, right? So that's our goal. And in that, we're building a database simultaneously to collect all of our information, all the data, because we are able to show that we have improved outcomes with patients. And so we want to be able to collect and share that data with the world. And then the 3rd goal that I'm putting all my energy in is the 29-year dream at this point of a metabolic trained Institute of Health, which is a residential integrative cancer hospital and research institute grown on a 300+ acre regenerative organic permaculture agricultural environment. So food, as you said, the foundation, the hospital is literally growing on a foundation of how we need to nourish ourselves and how we need to live on an unhealthy planet. And so every detail of that campus takes into consideration of everything from the EMFs to the toxic, the materials that we're building the hospital with, the residencies on the property, the farm to table restaurant on the property, the event center on the property. I mean, it's a massive undertaking. And so we're building that in Southeast Arizona to do this in the US, because the US is losing access to more and more and more of these very valuable integrative therapies. And so putting it under one roof as a research institute allows people to stay closer to home instead of having to venture and piecemeal together a very important protocol for themselves to get through a cancer diagnosis or any major chronic illness diagnosis. So that's where we're going. So you can find more information about that at mtih.org. That stands for Metabolic Terrain Institute of Health.org. That's the nonprofit hospital and research institute. You can find more information like podcasts galore and books. We've got a new book out this year with co-authors on mistletoe and the emerging future of integrative oncology, as well as the metabolic approach to cancer, which is celebrating its 5th year in 7th language and God knows how many copies worldwide at this point, which is really cool. And that you can find on Dr Nasha, DRNASHA.com. And I think that kind of covers it. There's a lot of places to find me out there in the social media world, Dr. Nasha, MTIH, any of those places. You can follow what we're up to, get on our website, get on our newsletter, and keep current, because I get to have conversations like this with folks like Dr. Nasha to keep access to this information that's free for you to keep listening to and learning from. So incredibly grateful to be here with all of you.
I'm grateful here. Thank you for sharing this information, because it gives people hope. And I think that's the most important thing about it. Hope gives strength to fight.
Indeed. Yes. Thank you.
Let's end it at that. That's a beautiful statement. Thank you, Dr. Nasha. It's been a tremendous pleasure.